Just by eating, does it cause obesity?
WHO has declared obesity is a disease. Bariatric surgery is safe surgery.
Is the treatment same for all types of obesity? When to consider bariatric surgery? So, is diabetes cured by bariatric surgery?
Compared to any other hospital, in PS University Hospital, we are doing the lowest cost in India. PS University Hospital has dedicated bariatric unit.
Hello everybody, I am Dr. Ramya. Welcome to PES University Hospital Health Awareness Program, where expertise meets compassion. This is the philosophy of PES University Hospital. Today we have many young individuals suffering from obesity, which is a major problem. So here we are to discuss about the treatment options which are available. We have Dr. Mutturaj, the professor from Department of General Surgery, PES University Hospital. Let's welcome him. Welcome, sir. Sir, what is obesity and how is it measured?
Obesity is a disease. World Health Organization has declared obesity as a disease. It's very difficult to measure the obesity, the fat inside our body, because there are two types of fat will be there. One is peripheral fat, means the fat under the skin, and one more is the visceral fat. Between each organ, the fat will be there. So those things we have to measure. So conventionally we use certain parameter, like first one is body mass index. That means weight in kg divided by 18 meters square. So here one individual for this particular height, how much weight it should be there. Normal body mass index should be around 18.5 to 24.9. So that is the normal body mass index. When the body mass index increases 25 to 30, we call it a overweight. If the body mass index crosses more than 30, that is called obesity. Again, the obesity in that is divided into class 1, class 2 and class 2 obesity. Class 1 is from 30 to 35 is the class 1 obesity. 35 to 40 is class 2. More than 40 is super obese, class 3 obesity. So like this, we according to body mass index, we calculate. So other method is waist hip ratio. That is also one of the way of measurement of body mass index. But here in both these things, it is difficult to measure how much fat is there in the between organs, that is a visceral fat and peripheral fat. That only can be detected by the in-body mass analysis. So that is body composition analysis, we say it. So in that, we can measure what amount of fat is there. Suppose in the upper limb how much is there, suppose in the abdomen how much is there, we can measure. That we should have a dedicated in-body mass analysis machine should have, which our PS institution is having that.
Yes, sir. We have heard there are many causes for obesity. So can you elaborate on it, sir?
Yes. See, if any of the obesity is there, people think he is eating well so much and that's why he has become fat. That is a wrong conception, because in fact that person who is eating will be eating less than the thin individual. So whatever one person, the set point is very important. Some persons eat food and their set point will be higher. Whatever they eat, they will convert into fat. That's why they cannot lose the weight. So that's why they cannot lose the weight. So that the other major factor is westernization. The people like pizza, burger, they keep eating, and lack of proper exercise. That is one of the major factor where childhood obesity is increasing. And other factors like genetic. Suppose the familial, some persons, parents are obese, then children are also obese, because that set point is like that. The body observed mechanism like that. Some genetic like gene mutation in a young child, small child also, because of gene mutation, they'll become obese. The other factors like hormonal, the people who take hormones or some endocrine tumor, or if they are taking some hormone therapy, they some medications like some antipsychotic medications that also cause obesity. So like various other factors, just not just eating, they won't become fat. There are multiple factors are there.
Yes, sir. So there is a bariatric surgery. What it is and when should all people consider about this?
Yeah, it's a good question. See, any obesity, the treatment is not same for everyone. We have to see there how much fat is there, body mass analysis, body how much BMI is there. If the BMI is 25 to 30 overweight, we won't advise bariatric surgery. For them, the treatments are one is we can try with diet and exercise for 25 to 30 BMI, and we can try with medicines. We have got new medicines have come. We can try with liposuction, balloon therapy, and so on. When the body mass index crosses more than 30, then we have to advise bariatric surgery. So, because along with diet and exercise, so when the BMI increases, if according to IRDA, if the 35 above BMI, likely chance of people getting type 2 diabetes, hypertension, cardiac problem are high. So they are the one who indicated. If the BMI is more than 40, yes, without any disease they are indicated. That is IRDA guidelines. All the insurance, everyone they accepted that.
Okay, sir. Are there any types of bariatric surgery?
So bariatric surgery is, there are various types are there. One is making this sleeve gastrectomy. We make smaller stomach by using advanced stapler. We make the small camera. We go inside. We make the stomach size smaller. That's we call sleeve gastrectomy. And we have a gastric bypass. Means we make the small stomach pouch and also we create the gastric pouch. So the gastric bypass length, depending upon weight. Suppose if they are 200 kg, still we can make 70 kg. So that's how we measure the bypass length. There are various other procedures, the gastric sleeve plus, and we have SADIs and so on.
So you told about many procedures, sir. So how does it help the patient?
See, this we give the option because one is the stomach size will become smaller. Suppose in the sleeve gastrectomy, 70-80% of stomach will be removed. That whatever the ghrelin hormone is being secreted, which increase the appetite, that will be lost. And even if they eat less food, they will feel satiety because the stomach size is smaller. Before they are craving for food, that will go, and also appetite will go down. And especially in case of gastric bypass, even if they eat food, whatever the excess of fat will be, they will create malabsorption. They will start losing the weight. So that's how it creates whatever the excess of body fat, how it is deposited over a period of few months, they'll be start losing the fat.
Okay, sir. So here is a new technology of robotic surgery. So something input you can give regarding that?
Yes. See, the journey of this bariatric surgery is from the almost 78 years back started. Initially, they started with open surgery, means cutting entire abdomen, making smaller stomach. That time, the advancement in the staplers was not there. And nowadays, in the last 30 years, we are having a laparoscopic surgery, means small pen like keyhole surgery. We go inside, we create the small stomach size, and also we create the bypass. And we have an advanced instrument like Ligashore, Enseal, all this have come, which has reduced the complications rate like anything. But recently, last few years, we have got the robotic surgery. Means robots, it has a 3D vision, almost 10 times magnified vision. It's more precise, and people who undergo surgery, complications will get very less. And patient can ambulate within 3-4 hours after the surgery.
Yes, sir. Now patients are undergoing the surgery. So what about the recovery? What should they expect?
See, whoever opt for the bariatric surgery, means if the BMI is more than 35, if any comorbidity is there, we indicate bariatric surgery. First thing we advise them, we have to advise them liquidate. Because people who are obese, they'll be suffering from fatty liver. The liver size will be very big. For those people, we do the liquidate few days before the surgery, and 1 or 2 days before we advise them to get admitted. Then we do all the fitness, physician, anesthesia fitness. If they have a cardiac problem, we get the cardiac fitness. If any risk, we explain to the patient and relatives. So then next day we take up surgery. The surgery time is around 1 to 1.5 hours time. And after that, 90% of the patients who undergo this laparoscopic keyhole surgery can get up and walk within 3-4 hours after the surgery. The after next day morning we start liquidate, 24 hours we'll observe. Then we will discharge after 1 days. So they can be ambulated within 3-4 days, and they can go to office within 2-3 days after discharge from the hospital.
Okay, sir. So anybody who is undergoing the surgery, the first question is what are the complications or any side effects? So anything should they be worried about?
See, there is no surgery without complications. But first thing we have to see is the patient, the complications, first patient factor, surgeon factor, and institution. We have to see. Patient factor means we have to see whoever undergoing any surgery, what disease they are having, whether they have any cardiac problem, whether they have any sleep apnea, any other issue. If those people having these any disease which have any surgery they undergo, there will be high risk. So that factor we have to see. Otherwise, the surgery wise, if you see, it is same as that of any other surgery. And second factor is the surgeon factor. The team which do the surgery, they should be experienced. If they are inexperienced team, any surgery they undergo, there can be complications. And the institution, and they should have all facilities, ICU facility and everything. If all the three factors is good, then I don't think any expectation of any complication, and this will be same as that of any other surgery, and it is, I can say, it's a safe surgery.
Yes, sir. Does the insurance cover this surgery?
It's a good question. So it is till October 2020 October, it was not being covered by any health insurance. People who underwent bariatric surgery, they get rid of their complications like type 2 diabetes, or sleep apnea, heart problem. Many things reverse or it's cured. Suppose if they undergo type 2 diabetes within 5 years, if they obesity associated with type 2 diabetes, there will be reversal of disease. 5 to 10 years, there will be reversal of their disease, diabetes will happen. That's why it has become boon. People who have gone to court and disease have been cured after undergoing surgery, why it is not being covered? So then it has directors, court has directed to cover the health insurance from October 2020. It's being covered by all health insurance, all the private insurance, all the central government insurance like CGHS, ESI, everyone is covering.
Yes, sir. The bariatric surgery is considered to be a major surgery. So is it very costly, and is it available in our PES University Hospital?
Yeah, it's a good question. The bariatric surgery, if you see, it is costly because use of multiple that staplers and high-end instruments. That's why it has become costly. That's why if you go to any private or corporate, it is difficult for any middle class to undergo surgery from there. That's why we started from our PES hospital, and this being covered by at a lesser cost. In fact, I can say it is being done at the lesser cost. Maybe it's lowest in any part of India. We are doing at such a lower cost, and it's affordable.
Okay, sir. Thank you for your input so much. So kindly can you give a take-home message in the end?
Say, bariatric surgery is a safe surgery, and the complications rate is same as that of any other surgery. And if you are thinking about affordability, PES hospital is the destination.
So we have learnt about obesity, causes, side effects, also the treatment options, and what are the complications you can expect after that also. And sir has also told about the cost, the insurance aspect about it. So let's thank him for telling about this brief discussion. Thank you, sir.
Thank you.